The AI is not a delegated entity. It is not making the determination, to Rob's point. It makes a recommendation to approve. We can take the recommendation and approve it, or we can say, nope, we don't want to approve it based on something else we might know. But it will make a recommendation to approve, and we can go ahead and take that recommendation, or to Rob's point, it will pend, and then that will go to a queue where a clinician will review that. So, and nothing gets denied unless it goes to a medical director. So.
Yeah, and one of the things I love is that, let's say that the medical coverage guidelines require 4 things, and that person trying to get authorization has only done 3, is saying, are you sure you want to hit submit before number 4? Like,
Yeah.
it's really
intuitive.
It's a lot, yeah, it's really helpful.
It is.
To the provider.
It really is, because a lot of the folks who are doing the data entry, they're not clinical, right? They're administrative staff that have been hired to do a very repetitive job that is very, very hard. I mean, these people have 3,000 stickies, covered on a wall because Florida Blue wants this, and so has this, and Cigna has this, and if it's, purple and on Tuesday for this person, yeah, it goes here. It's a lot, we as payers expect a lot of providers, and we expect them to know a lot of things. And so, that's one of the best things about this is it is in Availity now. It's with Availity. It's going to be with an agnostic payer. It's going to be in a portal that many payers use. And one of the things that I know when we began this journey was providers do not want to change their workflow. They don't want to change it for me, Florida Blue. They don't want to change it for anyone. And I don't blame them, right? They're running their practice. They have a way to run their practice, and that's how they're going to run their practice. And if they changed it for me, then it wouldn't work for another payer. Mm-hmm. And in my state alone, in any county, I'm competing against 9 to 14 different payers. So it's not, I don't have, I'm not the only payer here. And so for me, I have to be thoughtful about that when I'm asking, providers to change what they're doing. And I know that they're not going to change a lot of what they're doing. And so I need to be thoughtful about that and bring solutions to them that are part of their workflow. And I think that's why thinking about using this and, exploring it with Availity is probably something everybody should be thinking about if you are using Availity, or if you are using any kind of APIs, because it's an opportunity for you to engage with your payers and your providers, whichever side you sit on, because once again, it's really the way to connect. And it's a way for you guys to solve some of the problems that we all know that we have around prior authorization.